Hello and welcome to another edition of Professor Speaks. For our topic today, we're going to talk about the rise of STDs in the retirement communities. But before we get into that, I would like to remind you to hit subscribe and hit the little bell for notifications. Hello and welcome to another edition of Professor Speaks. As I mentioned in the intro, our topic for today is the rise of STDs in the retirement community. And here to talk about it with us is Dr. Craig Stern himself, expert, right?
I'm being set up.
My name is Alex Hernandez, and we wanted to talk about this topic a couple weeks ago. It was April. April was STD Awareness Month, and we know it's mid-May, or actually the end of May, but we still wanted to cover this topic because it's a growing topic. It has potential to grow even more. So what we're seeing is it was based off of an article. Correct me. What article was it from? Huffington Post, right? Huffington Post did an article. Thank you, Em. Thank you for contributing. Huffington Post did an article on the rise of STDs in the retirement communities, and we thought it was an interesting topic, and also a very dangerous topic because STDs still has a bit of a stigma attached to it. Craig, you want to mention anything about has anything come up in articles?
Yeah, let me try and put this in context.
Mm-hmm.
Sexually transmitted disease is a huge topic. The Centers for Disease Control, the CDC, calculates and publishes information about the incidence of this on a very regular basis.
Uh-huh.
It has a major emphasis in the younger population, and somewhere between 15 and 24-year-old, where there's a significant number of cases, over 600,000 cases of it every year.
And that's where you would usually hear it.
You would usually hear it.
And the billboards all mention the gay community and even the straight community.
Which brings up a good point, and that is there's also a certain social stigma about the whole thing with regard to the gay community and HIV, now issues with regard to Hep C and others. Bottom line is these are infections, whether they're caused by certain bacteria or other kind of more complicated infections as well as viruses.
Right.
And irregardless of the social issues, these are diseases that pass from one person to another with sexual contact. So it's not just one person involved, it's the person and their sexual partner that's involved. Mm-hmm. And so these things have the opportunity to expand. The problem here is that the number of cases of this has been increasing dramatically. As they do that, they begin to look at subsets of the population to find out what's going on. And that's where, when they looked at it, they saw, well, wait a minute, in the nursing homes, in elderly people, in people over the age of 65, etc., then they began to see that the trajectory of new cases is faster than the overall trajectory of all of the rest of the population. Wow. So even though it's a much smaller group of people, over 2,000 cases, versus the younger people that have over 600,000, the trajectory of new cases is increasing dramatically. That's why this became an issue. That's why they're talking about it. And obviously, overall, all of the cases are increasing. Right. But in this particular case, they brought it up, and we'll talk about specifics.
Yeah, and I think the other main reason why this comes up is because we mentioned before that we usually only see it in the younger community. So we're asking, why is it happening in the older community? Yeah. Because, the younger community, for obvious reasons, they're growing, they got testosterone levels are rising, and then one's attracted to the other, and so on and so forth. You don't really see that in the older community.
Well, the older community has some different things than what has been seen in the past.
Right.
Number one is the number of baby boomers and those over the age of 65 has been growing. Right. So the total population is increasing. The second part of it is that in the 60s, when many of these baby boomers would have been at a sexually active age, the major issue at the time was birth control pills as a matter of dealing with sexual activity.
Mm-hmm.
Condoms were there, but not as common.
Right.
So this community, in a general way, doesn't use condoms as much as one would expect as a barrier to sexually transmitted disease. Secondly, is the number of people that have become divorced over this period of time has risen dramatically.
Mm-hmm.
So we have a whole group of people who are single,
right,
and otherwise that have the capability of dealing with sexual activity that is either inside or outside of marriage, and a good deal of it outside of marriage, at least half of it.
So single and mingling.
Single and mingling.
Yeah, exactly.
And then the third issue here is that as the women age, especially after menopause, after their early 40s, 42 to 44, etc., they are using issues with regard to estrogen creams, some cases progesterone creams. What it does is it makes the sexual activity more satisfying, but it also increases estrogen stimulation. So there's an interest on the female side. On the male side, we've had this whole thing of what's gone on with erectile dysfunction and medications to treat erectile dysfunction.
Right.
So you have some medication and conditions in order to make the men more interested and more potent. You have indications on the female to make it more potent. The common denominator is that obviously
more sexual
activity. Finally is the issue that as women age, and especially after menopause where there's less estrogen, the membrane of their vagina and their endometrium becomes thinner. So as a result of that, there's a greater chance that when they have sexual activity that there's going to be infection because the estrogen is not protected as much as it was when it was a thicker membrane. As a result of that, the impact of the sexual activity becomes worse. And so more people doing more things with some physiologic issues involved that creates a real problem with regard to sexual activity.
Another thing that came to mind while you were talking there, you mentioned the population and the generation that's coming up. I mean, the sexual revolution and all that stuff. But also, we got to think about the sex education at the time. Yes. Because it's more than just having sexual activity. It's the awareness of what happens during intercourse, about the infections that can occur and how to protect yourself from it.
You're absolutely right. Yeah. You're absolutely right. At the end of the day, whether it's the CDC, the World Health Organization, or anybody else, the bottom line is education. Whether it's for the young people, where the greater volume of patient problems are, whether it's an elderly population, an HIV population, a Hep C population, it's all about education. You have to be able to tell people that it's not just a matter of having sex or otherwise, there are complications to it. And these complications can be serious. It is one of the reasons in education about using barriers like condoms or creams or otherwise. There's also issues with regard to educating people to know what some of the symptoms are, because the symptoms can be catastrophic. In the younger people, it can involve where they lose their opportunity to become pregnant. In elderly people, they get major infections. And so any intercourse that is unprotected then becomes something that people have to go get checked, that they have to understand what are the barrier kind of things they should do, what should they do if they have unprotected sex. Education, education, education. That's where it's at. And by the way, the CDC has a host of things up on the web, so people can go there. I think Em will add some links to the CDC there, right? So that people can go and look and see what the educational issues are. Because if one person gets it, it's not just that one person. It is whoever they were in contact with that is also involved. And depending on where it was done or otherwise, they may have to deal with it with regard to the sheets on a bed, or they may have to deal with other materials that were used, so that this is taken care of. It's not just a one person treat one person problem.
Right. Well, another thing came into mind. Kind of getting out for the technical now. You're talking about the elderly, right? You got 65 and older. Have you ever tried to educate someone that was 65 and over about something, and they actually take it in rather than just tell you to get out?
That's a problem.
This might be tougher than we think, right?
It's not easy, but whether it's whether you deal with it as a scare tactic or not,
right? You
have to be able to tell them that there is a problem, and if you have difficulty in that communication, then somebody has to take the role of taking them in, having them seen, having them tested. Testing is direct, it's easy, but understand that there are multiple diseases going on here. So it isn't just one bacterial infection and treat it with an antibiotic. You have a host of different things to deal with. Certainly chlamydia is the most common,
right?
But so are scabies. But at the same time, gonorrhea and others.
And HIV too.
HIV, it's not just one disease, so you have to be tested so that they can address it. And then there are treatments for each of them, but you can't just assume this is one easy thing and I'm going to take a drug and I'm going to treat it and it'll be done right away.
Right.
Even in some of them, like gonorrhea, it's treatable, but we've had problems over the past decade or two where it's become resistant.
And we've talked about that in prior episodes.
We have.
Yeah.
We have. So we have to be very conscious of the fact that people, if they've had unprotected sex, they need to go get tested. If there's a problem, it can be dealt with, but it's not just a one vector, one problem kind of deal. It could be multiple things, and it needs to be distinguished in the testing as to which one is the problem.
Right. And I'm going to say something that might make you guys uncomfortable. Oh, I should have said this at the beginning. Viewer discretion is advised. That some of you with parents or uncles or grandparents or uncles and aunts or grandparents that are in retirement homes, you might have to get involved and kind of educate or try to educate the retirement community, because it is growing and the population is growing and this is going to be a increasing problem.
Yes, and it can happen at home.
Yeah.
It could certainly happen in a retirement living facility.
Yeah.
It could happen in a skilled nursing facility. It could happen in many different places. And some people are kind of cavalier about it, so they deal with it. Unfortunately, it isn't just them it's the problem. It's the person they had contact with.
Exactly.
And if they have contact with multiple people, then it's not just one person, it's multiple people that are involved. So yes, everybody needs to be aware. Everybody needs to be tested. Everybody needs to be educated about what to do.
So yes, if you're asking, I'm telling you, ask your ask your parents or your grandparents or your aunts or uncles that are in the retirement community. Are they sexually active and are they using protection?
Yes.
That's your one chance to actually get back at them for coming at you. Is there anything else you'd like to add as far as solutions? Maybe there's a...
No, what you might want to do, and we have some statistics, is just let people know, the volume of what's going on, because the speed of all of this stuff is increasing. You may want to let them know what we're looking at, because it's not insignificant.
Some of those stats that Dr. Stern was talking about come from the CDC, and it's 2,616 cases in 2014 alone, with the total volume of 686,722 cases amongst the 20 and 24-year-olds.
Right.
That's a huge
But
population.
in the elderly population, you're looking at increases in syphilis, gonorrhea, that are in excess of 50%. So this trajectory is going up very fast in what's happening.
And this might be shocking to some of you that 53% of the older population, of those that are 65 and older, are sexually active. And year-to-year increases with 20% increase in 2016. Wow. And chlamydia, as Dr. Stone was talking about, chlamydia has a 52% increase. Syphilis, 65% increase. and gonorrhea with a 90% increase. And that's especially scary because of some forms of gonorrhea are untreatable at the moment.
Well, some forms, there is a resistance problem,
Yeah.
and so it requires a different a group of drugs to treat in order to deal with it. And with the activity, the chances of antibiotic resistance goes up. So
Exactly.
it's terribly important that people are made aware and are educated about this.
Yes, all jokes aside, I mean, this is a serious problem, and it is increasing as every year goes by. As we try to keep people living longer, they're living longer, more problems are arising. So that's all I have for today. Anything else, Dr. Stone?
No, I think that's
We'd
it.
like to thank you for watching the show, and remind you to like and comment. And we'll have new videos for you every Friday. I'll try to stay here and try not to travel. You too, Dr. Stone. And make sure to visit propharmaconsultants.com. We still have a free information page called RxInfoX. If you'd like to send us a message, if you have any topics that are coming up that you'd like us to talk about, that you'd like more information on, please feel free to message us. And we will see you next week. If you like this video, please hit subscribe. If you don't like it, still hit subscribe.